Hello and welcome to this Sleep Appliance Bite Record video. My name is Dr. Steve Lamberg. I am the developer of the Sleepwell appliance, which is made exclusively at the Appliance Therapy Group, also known as Space Maintainers. The purpose of this video is to show you, the dentist, how to make a bite record so the laboratory can fabricate your patient's sleep appliance in a comfortable and efficacious treatment position. We strongly recommend using a George gauge to convey an initial treatment position to the laboratory. This is a George gauge, and this is the bite fork which goes into it. Use a George gauge to calculate the anterior-posterior range of motion of the mandible. First, we adjust the George gauge to receive the incisal edges of the lower teeth. We place it on and then tighten it. So the incisal edges of the lower front teeth go into the lower notch. The bite fork assembly has a notch for the upper teeth. Then we put them together, and there's a scale, and that's how we measure the range of motion. So we're going to ask Sarah to close down into that notch. And now I'm going to ask her to move all the way forward with the lower jaw, and I see +5, and all the way back, and that goes to a -5. That's a 10 millimeter range of motion. You can start most patients between 60% and 70% of their range of motion forward in a protruded position. In this example, that would be 6 to 7 millimeters protruded. In this case, I want to go 60% forward. So we go from the -5, which would be 6 millimeters forward of that would put it at +1. I tighten that, and then we're going to place it in her mouth. Bite down, please, just to see how that feels. And we ask her, does that strain the muscles or the joint? Is that okay? Mm-hmm. Okay. Now we're going to open, please. We're going to put some wax on this, and then we're going to seat it and get our bite record. After we put the warm wax that's been heated up to 140 degrees onto the bite fork, we go into the patient's mouth, and we position it so that it lines up with her skeletal midline, not the dental midline. And we ask her to close, please, bite down into the 2 notches. After you have the bite record, all you do is unscrew the top screw, remove the bite fork, you keep the George gauge in your office, don't lose it, and you send this little 25-cent bite fork with your registration material to the laboratory. Visit us at www.lambergsleepwell.com, and good luck in dental sleep medicine.